So traumatic brain injury is an injury that occurs to the brain, and the way to envision it is to think of the brain as this very soft organ. It actually has the consistency of formed jello in the natural state, and it floats in fluid inside of your skull. And when there's a blow to your body or to your head, the brain actually moves back and forth, and it's that movement inside the skull that actually causes the injury. You can imagine the brain kind of squeezes on itself when the body or the head gets hit, and then it stretches and may twist a little bit. And it's that twisting and stretching, particularly of the nerve cells, that results in a brain injury. So when we think about traumatic brain injury, we often talk about severity. So there's the most mild, so to speak, which are commonly referred to as concussion, and then they go up in severity to a moderately severe traumatic brain injury, and then to severe traumatic brain injury. And when we think severe traumatic brain injury, we're thinking folks who've had a lot of force applied to the brain. There's swelling inside of the brain. There may be bleeding. Oftentimes, not always, there's prolonged loss of consciousness and coma. And then on the more mild side, concussion, there may or may not be loss of consciousness, and the symptoms and severity typically are far less severe than they are in the more significant injuries. First of all, when in doubt, seek out help, whether it's in an emergency room or you call your healthcare provider. Seek out help. And if you're not feeling right after a concussion, there's often this anxiety that there is just something very seriously wrong with me, and that just adds to the anxiety. And when you add anxiety and depression to the symptoms of concussion, that's not a good combination. So seeking out good care, getting answers to your questions early, is actually a good way to help speed up the recovery.